Welcome to Blooming Dandelion, where we explore healing, growing, and evolving to live a balanced and fulfilling life. I'm your host, Andrea Rivera Cazul, and each week we'll dive into practical tips, inspiring stories, and expert advice to help you bloom. Let's get started. Hello, my dandelions. Welcome back to Blooming Dandelion. Today, I want to go not off script, because I do have some key points that I want to bring up, but I wanted to do more of a low-key podcast episode. I wanted to do kind of like a check-in. I know that I probably will not release this the day of, but today is November 3rd, is it? 4th. Today's November 4th, and I know as someone who deals with mental health and mental illness, the importance of doing check-ins, of checking the temperature on things, on making sure that there's someone that we can speak to and talk to. And I definitely, as your host of this podcast and as someone who just needs to talk about these things, I definitely have been feeling the sense of dread, anxiety, all of the feelings. And I mean, it comes from so many different places. It has come from dynamic shifts with people that we love. It comes from work stresses. It comes from relationship dynamics of even friendships and interpersonal relationships, and how do we carry on our relationships, but also make sure that our personal life and work life, everything is balanced, because it's a lot. Being an adult is hard. Navigating life, especially as we all know, we have never gone through this experience. We're learning so much independently, we're learning so much as a community, and it's okay to still be lost. It's okay to not be okay. It is okay to feel the sense of, I don't know what I'm doing. I think that there has always been these pressures of us having our life figured out before 30, or these milestones and our ages, and this needs to be done, and why don't we have a house, and why don't we have this? There's so many pressures that society has placed on our shoulders, that maybe our family members have placed on us without knowing. There's a lot, and I can say that as someone who experienced the 8 years ago, the voting of the president, and I was in Iowa at this time, there's a lot that is almost stressing me out this time around, and I have had a hard time trying to place my concerns and worries and like, where do they go, because these are things that essentially are out of my control. And I think that when it comes to these worries, these concerns, or even things that trigger our mental illnesses or our mental health in question, I think it comes to a point where we have to also say, what can I control and what is out of my control? And I'm shouting out my mom, because she definitely mentioned that today. She was like, these things are out of our control. We did what we needed to do, and at this rate, it's just a waiting game. And I have to say, I'm grateful to be here. I'm grateful to have a platform, or start creating a platform to voice my opinions. I am grateful for folks that I follow that have given me more confidence. And I am also grateful for folks that remind me that not sharing my opinion could essentially say that I don't care. And I don't want to be a person that doesn't care, and I don't want to be a person that doesn't advocate, and I don't want to be a person that stays silent. That's me. And I know that some folks can still be navigating those waters and not know where to stand. How do you speak up? How do you say what's bothering you? But also, how do you navigate even these political waters right now of so much separation? How do we get to a place where we can hear each other out? And I think that there is a way to hear and listen and talk, but there are a lot of folks that aren't ready. They're not ready to listen. I'm not sure why. And it is passed down. It's taught. It's not something that they're born with, which can be really demoralizing and saddens you. And I wanted to kind of take this whole thing, and really I had written an episode up on kind of like mental health and mental illnesses and how it can show up. And I think that it's the best time to talk about these things, and hopefully, you know, you can get to listen to this maybe. I'm hoping to post this the day before election, so hopefully we get this done. But hopefully you can listen to this on election day, past election day. You can listen to this and see where it is that you stand on, you know, sometimes we don't know that we may be experiencing a mental health crisis. And it's important to know these facts, and it's important to know what to look out for. It's important to know that we aren't going crazy, that these are actual things that are happening to us, because we sometimes are so gaslit into believing that we don't have depression or we don't have this and you're just stressed out. Well, stress can manifest in so many different ways, and depression can manifest in so many different ways. And so I just I did a lot of digging through NAMI, which is the National Alliance on Mental Illnesses. I think that when it comes to these things, we need to make sure that we're united and that we speak up when we're not feeling well. So I want to share some fast facts that are easily accessible for folks on the internet. If you want to go to NAMI's organization and their website, they have all of these data and fast facts, which I find useful. But I'm going to go through the list of them, and hopefully we can learn together. We can just take this time. The previous podcast episode was a guided meditation, but sometimes we just need to listen to somebody else give us some information, and how we can possibly go and advocate for our mental health. So the NAMI helpline is free. It's nationwide and peer supported. It provides information, resource referrals, and support to people living with mental health conditions, their family members and caregivers, and mental health providers in the public. The NAMI Teen and Young Adult Helpline offers a direct connection with another young person who shares similar experiences and is prepared to offer information, resources, and support to help you move through difficult times to a better place. I honestly think that that's so helpful. I think too many times teens, young adults feel like adults don't understand me and may not feel connected to an adult provider, and to have someone that is trained and is navigated through that, I think is really important and amazing. If you are experiencing a mental health crisis, you can call, chat, or text 988 to speak with a trained crisis counselor 24 hours a day and 7 days a week. Here's a couple of facts that you may not have known. So 1 in 5 U.S. adults experience mental illnesses every year, and only half receive treatment. 1 in 20 U.S. adults experience mental illness each year, and only 2/3 receive treatment. 1 in 6 U.S. youth experience a mental health condition each year, and only half of them receive treatment. 50% of all lifetime mental illnesses begin by age 14, and 75% by age 24. The average delay between onset of mental illness symptoms and treatment is 11 years. 122 million people live in mental health professional shortage areas. And that, I think, is insane. I think that not having access to a mental health care provider is absolutely just not okay. I can tell you a little bit of my experience and my time as a hall director, area coordinator, and also a student back in Iowa. I experienced my first mental health crises on campus, and I didn't know who to go to. I didn't go to the any of the counselors. I did not go to the mental health office. I did not go to the nurse's office. I didn't go anywhere. I suffered silently. I didn't share what was going on, and it ate me up. And I think it worried my parents. From me being in Iowa, my parents being in Puerto Rico, it ate them up. It wasn't something that they knew how to help out with. They had never dealt with mental health in the capacity of using a counselor or finding someone that could help support. This also ended up being kind of the wake-up call of me finding out that I was a sexual assault survivor, and so there were a lot of light bulb connections that I was finally making and never spoke out about. And we were in a mental health care shortage area. Even with the hospital being so close to us, there were not enough mental health providers. We were being trained to be mental health care providers in emergency situations, and it was never enough. It was never enough. So I can validate how hard these things are, and I can't imagine more campuses being on shortage areas with how much stress students get induced and are put through their time in college. In 2020, 1 in 5 young people reported that the pandemic had a significant negative impact on their mental health. In 2020, there was a 31% increase in mental health-related emergency department visits among adolescents. As of 2021, 1 in 10 young people under age 18 experienced a mental health condition following a COVID-19 diagnosis. More than 3/4 of Americans, which is 76%, say they are not content with the status of mental health treatment in this country. 7 in 10 Americans, 72%, agree that people with mental health conditions face discrimination in their everyday life. Only half of Americans, 53%, say they are familiar with the U.S. mental health care system. These numbers are atrocious. And it is so true, the level of discrimination that folks with any type of mental health crises or even mental health condition experience. As I was working at an in-home school and care treatment facility, the days that we would go out and go in public and all that stuff, you could see visibly how people treated my students. You could see how we had to go through trainings to support our students while in the outside world because we were so sheltered at the school. And I truly think that COVID-19 impacted us in so many different ways. COVID-19 shed a light on a lot of people. I was working, and truly, the work experience in itself with COVID-19 of working at this school and having to still be a person that was essential. I worked the whole time in COVID, and we had students that could not go home, whether that would have been because their case was severe or they just were wards of the state. It was a lot. And having to support students, plus support yourself through that uncertainty, I would say uncertainty, and there was so much dread during that time for some students, and not being able to leave and be locked in one place. And I know that the US was not as strict as so many other places. And for us to even have gone through those times and still had more leniency in how we treated COVID-19, I think that it says a lot. I will say that as time has gone on and I have become more of an adult, and I've taken more trainings and read more books and dealt with a lot of my cases of traumas and things that I needed to discuss with the provider and myself, I realized how necessary a counselor was. And I'm still in that stage of I cannot find a mental health counselor. I have good insurance, I have a good job, and still to this day, I cannot find a mental health counselor. I can't find a psychologist. And that is telling. And I will say that I'm a person that independently does a lot of work and does a lot of self-help and speaks up about how they're feeling, and I'm grateful that my primary care physician is someone that advocates for me. I am very fortunate, I'm very lucky, and I know that and I realize that. But I think that there are some folks that don't have that privilege and pleasure of having someone who really advocates and listens. I got here, and the first thing that I discussed with my primary physician was that I was a domestic violence survivor. I told her everything that I go through. I have told her about my stresses. I have told her about the changes in my life. And she has heard every single thing and always had a plan to help me out. I would say that one of my latest ones has been that I have been feeling very anxious, a lot of dread. I have been feeling like I have been needing a diagnosis in the sense of maybe I have ADHD, and one of the game plans was that if it had started affecting my work, that she would essentially help me out to figure out a game plan. And it got to a place that it started affecting my work, and I mentioned it. I was like, hey, let's recall some time back there where we said that we needed to keep this vigilant, and I mentioned it. And I would say the first step that she put me on was putting me on medication. We have not tested for ADHD, but she gave me antidepressant medication, and I have noticed, because you have to take it for some time and check in and make sure that everything's okay, I have noticed that unfortunately the medication has not helped me. I have noticed that certain anxieties, certain things have dealt its way up, and I've thought to myself, I'm like, is this something that I need to now really hone in and find a psychiatrist? Is this something that I need to discuss with my PCP? And maybe it's a higher dosage, or it's a different medication. There's so much. There's so much that we navigate, and we don't have all the answers, which is so important to speak up and talk about what it is that you're going through. It's so important to say that you're not okay. It does not make you weak. It does not make you less of a person. It just makes you strong for being vulnerable. And whoever uses your vulnerability as an attack back to you, they're a weak person. They don't respect you, and they don't care about you. So find better people in your life, okay? Because whoever weaponizes your vulnerability, whoever weaponizes how brave you are for speaking out and saying, I can't do this and I'm not okay, they are a weak person for treating you like that. So find better people. I will say that. I make sure that on days that I feel my energy depleting and don't feel like myself, that I find ways to pour back into me. I try to not make any times of days or visits with friends, or if it is that I need more energy with friends and need to get away from certain things, I make sure that I prioritize those things. I make sure that I prioritize things that make me feel good, and sometimes that's either eating a really healthy meal because I've been feeling like I've been dragging from eating different other things, but then other times it's I just need to be lazy and I just want a slice of pizza, and I gotta listen to these emotional cues. The other things that I do, I sometimes just need to move my body. I realize that I have taken 5 days off and I feel like crap. What can I do? Let me go for a walk. Let me just sit outside. I have found that sometimes it's reading an audiobook or reading and listening to an audiobook. It's literally finding new things that you can dive into and explore. There's so many different ways that folks feel like they're pouring themselves back in, and you have to figure out what is that thing? What is that thing that will make things better and will make you kind of reset, take some time for yourself, and continue on the next day. It's so important to find that out. I want to take a little bit of time to talk about the common signs of mental illnesses in adults and adolescents, because I think it's really important. If you are someone that doesn't know if they are going through a mental health crisis or is feeling overwhelmed or anything, maybe this can help you kind of put it into words. And I'll tell you a little bit about kind of next steps that you need to take sometimes with this. And again, I'm not a medical provider. I'm just a person who is 31 years of age, who has lived some parts of life very hard and can hopefully give you advice and hopefully give you that sense of reassurance that maybe you're not getting anywhere else. So here are some of the common signs of mental illnesses in adults. Excessive worrying or fear, feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability, that word is hard, or anger, avoiding friends and social activities, difficulties understanding or relating to other people, changes in sleeping habits or feeling tired and low energy, changes in eating habits such as increased hunger or lack of appetite, changes in sex drive, difficulty perceiving reality, so you might have delusions or hallucinations in which a person experiences and senses things that don't exist in the objective reality, the inability to perceive changes in one's own feelings, behavior, or personality, so the lack of insight, or anosognosia. That is a word. Anosognosia. That is one word. Overuse of substances like alcohol or drugs, multiple physical ailments without obvious causes such as headaches, stomach aches, vague and ongoing aches and pains. Thinking about suicide. That is a big one. Inability to carry out daily activities or handle daily problems and stress, an intense fear of weight gain or concern with appearance. So mental health conditions can also begin to develop in young children because they're still learning how to identify and talk about thoughts and emotions. So some more obvious signs are behavioral. So symptoms in children may include the following: changes in school performance, excessive worry or anxiety, for instance, fighting to avoid bed or school, some hyperactive behavior, frequent nightmares, frequent disobedience or aggression, or frequent temper tantrums. I think this list is really comprehensive. I think that I'm very grateful for NAMI for putting this. Again, NAMI is the National Alliance on Mental Illness, and they have so many more resources when you go to their website. Sometimes we need more help, a little bit more hand-holding. Sometimes we need support groups. Sometimes we just don't know where to start. And sometimes it's just finding it out. I remember NAMI being one of those campus-led activities and things that we had on campus. I think we had a club on campus that helped us out. It's important that when you are feeling any of these things, if you have been feeling this way, bring it up to your primary care physician. They are the first step if you don't have a counselor, that they can help you. And if they see that it's an emergency, they'll take action. It's okay to not be okay. I have to repeat that every so often, because it is so easy to think that you are a problem and that there's no solution to whatever we're going through. And I promise there's different ways that we can. We just need to find what it is that we need. But when you go on NAMI.org, there's support, there's education, there's podcasts and webinars. There's a video resource library. There's support groups that they can send you to, and they can link up information on what it is that you may need. I would say that if you need more resources and need to connect, I think that there's great local NAMI networks that will help you out. I believe that there are in every state, hopefully. But I believe that there are. I just, pulled up Massachusetts, for instance, and there's affiliates. Their contact information is in Woburn, Massachusetts, which I think is great, and they have different entries. So know that you're not alone. Know that so many of us are going through this, and even a normal person such as myself who has a podcast, who launched it and felt motivated to be hopefully a big sister, a daughter, a lending voice to those who may be feeling voiceless. That someone who felt empowered to do this also has a mental health illness and still needs to navigate life by figuring out what's going on. People showcase their lives as perfect. People love to think and say that nothing is wrong. Nothing can harm me, nothing can touch me. And what a great idea to be invincible, but we are not. We are not, and we shouldn't act like we can't. Help each other out, build community, and have some empathy towards each other. I just wanted to share that because I think that I needed to vocalize and say, I am feeling stressed. I am feeling lots of anxiety and I would say mild depression. I'm doing things to take care of myself and speaking to family and friends that keep me at a homeostasis, at a baseline. But I know that if things change, I know where to go. I know my resources, but I wanted to share so that you knew where you can start finding those resources for yourself. I really do hope that you find some peace in the next couple of days, that you take time for yourself. I hope that you understand that you don't have to go to work if you don't have to. If you have time, take the time. It's okay to take a day off. It's okay to just be and to settle and to get things situated. And it's okay to speak up if you need the help. I really hope that you know how much you are cared for and loved. And I hope that if you haven't heard that, know that I am proud of you for taking the time to listen to resources, for taking the time to think about yourself, and for putting yourself as a priority. I love you. Thanks for tuning in to Blooming Dandelion. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review. Follow us on social media on Instagram at Blooming Dandelion Podcast for more inspiration. And remember to keep on blooming. See you next time, dandelions.